Other news now. Later this morning, a CDC advisory panel holding an all-day meeting to review data on whether COVID-19 booster shots may be needed in the future.
12 News reporter Alexandra Leslie joins us now. Alex, the panel is also planning to make recommendations on how to address new safety concerns about the J&J shot.
Yeah, so the Advisory Committee on Immunization Practices was taking a closer look at the roughly 100 reported cases of Guillain-Barré syndrome, or GBS, among J&J vaccine recipients. As we've reported, that syndrome is also a possible side effect of seasonal flu shots as well as shingle shots, and it's a rare neurological disorder. Now, action has already been taken by the FDA. The label and fact sheet for J&J's vaccine now note that reports of adverse events suggest an increased risk of GBS. Of the 100 reports, the FDA said 95 had to be hospitalized and there was one death. The panel is charged with deciding whether or not the benefits of the vaccine still outweigh potential risks. Now, a new study that has not been peer-reviewed and is based on lab experiments also suggests an even lower efficacy of the single-dose shot when facing the highly contagious Delta variant. However, the conclusions are at odds with those from smaller studies published by Johnson & Johnson earlier this month, suggesting that a single-dose shot of the vaccine is effective against the variant and even 8 months after inoculation. Now, right now, all three vaccine makers are looking at boosters, though federal regulators currently don't recommend them.
It may be that a second dose of Johnson & Johnson may be just as effective as 2 doses of other vaccines. And then at the end of the day, it's a different approach to vaccines. The Johnson & Johnson uses an adenovirus vector versus the Pfizer Moderna, which use mRNA.
Now, in that same paper, researchers also suggest if so-called breakthrough infections result in an increase in severe COVID cases, that booster shots for all three vaccines are should be strongly considered rather. That CDC panel will discuss the possible need for boosters in immunocompromised people today, though no vote is scheduled on that. Live in the control room, Alexandra Leslie, 12 News.